OT life hacker here. So I got tricked by my patient today. I got tricked, I got duped, I got fooled, bamboozled, pranked, however you want to say it. It happened to me. Oh. It was so funny. I mean, yes, it's not exactly meant to be funny because it was more like, you know, the patient giving me the middle finger here, but it's still funny. So this is beware, everyone, to all of the occupational therapists and healthcare professionals out there working with patients, especially in the hospital, in the acute care. So I am an occupational therapy student doing my level 2 field work, meaning I get more hands-on experience, kind of like an internship or practicum. And so I'm out in the setting actually working one-on-one with patients, and I am doing my occupational therapy field work. So we get to work with patients in the hospital doing their basic activities of daily living, such as brushing their teeth, washing their face, brushing their hair, stuff at the sink, stuff in the bathroom, and even doing things like walking around the hall. And yes, you see PT doing it, but also OT does it too, because we're trying to ambulate the person so that they can do the activities that they need to do at the sink or the bathroom. Alright, that's my spiel on OT. Now let's get into what happened. It's pretty funny. So this morning at about 7 o'clock, I checked in on a patient, and they had been eating their breakfast, and they said, well, they had their breakfast, but they were too tired to eat their breakfast too. I walked into the room and they said that they're really tired. Can I come back later? So I said, okay, sure. I came back about an hour later, and they said they're still really tired. They're going to take a nap. Come back later. I come back later, and they're very, so the whole time they're pretty lethargic. They're really tired and just didn't want anything to do with me really, because honestly they were kind of like, no, I don't want to see you. But in orthopedics, when they had an elected surgery done, so that means that they are the ones who choose to have the surgery done. They go into the hospital, they are all prepared, they know what to expect, they know they're gonna have therapy, they know they're gonna need therapy to get better. And so this person was like, I don't, I'm like trying to think of many different excuses to give me. And the policy that we have is kind of like, in order to help the person get better, you need to, and not just policy, how life works, is in order to get better, you need to help get yourself moving, especially if you just had surgery that is, you need to get it working again as soon as possible. Then that's what we're here for, to help you get back to what you need to do at home, get you home, which is what everyone's goal so far that I met has been, and that's her go-to. But it was so funny because I came in, I think it was the third time that I had come in, and this was later in the afternoon, around 1 o'clock now. I come in and she said she was so much more happy, and I was like, oh wow, that's fantastic. You look so much better than you did this morning. I didn't say that, but I was thinking, wow, she looks a lot better. And so I was like, oh hi, it's me again. She's like, oh hey, can you come back at 3? And she was eager to do it at 3. I was like, oh sure, yeah, because I said, oh, can we do it now? She's like, oh, now it's not good, but how about 3 o'clock? I was like, oh well, she's really chippy about this. Sure. I should have seen it. I should have known this was an alarm, guys. Because I come back at 2:35, and I didn't mean to go to her room, and I didn't go to her room just yet. I come back at 2:35 to the floor, and I started doing chart reviews, and she was on my list. I had my own list, and on my list it said she was discharged. Oh, discharged, which means she went home. So I'm like, no, did she? I go to her room and it's empty. She has her food left behind. Her food was eaten. everything was gone. And not only that, to make things worse, one of her nurses walks in and her nurse is like, hey, where'd she go? Even the nurse was surprised. She's like, wait, I didn't know she got discharged. And I was like, oh, that leaves us both. We're both out in the out in the cold here. We both were just like dumbfounded that the patient left and just tricked us both. So yes, that's my little fun spiel of the day. Do not get tricked, guys. If your patient looks grumpy in the morning or one moment and then looks chippy the next moment and it's not because of cognitive stuff, well, best beware. Something's going on. They're happy for a reason and it's probably not because of you sometimes. Wasn't for me this time. Yeah, so what a nice surprise. But at least that means if she was discharged and able to go home, she probably didn't need occupational therapy services. So okay. Good to know. Alright, so talk to you guys later. Bye bye.